Hello, ladies and gentlemen. This is Nishant, and welcome to another episode of the Nishant Garg Show. This show is for people who want to live a fulfilled life through mindfulness practices, psychology, and personal transformation. My job on this show is to invite world-class performers to share their practices to live a fulfilled life. This episode guest is Dr. Tracy Ochester. Dr. Tracy is a licensed psychologist and a mindfulness educator and registered yoga teacher. She helps clients tap into natural ability to live life fully with presence and wisdom. Guidance and mentoring are provided in increasing compassion, awareness, insight, and balance, as well as sustaining motivation for the cultivation of well-being. In her psychology practice, she provides quality, confidential mental health services to individuals, families, and organizations in the Kansas City metro area. And now let the episode begin. Dr. Tracy Ochester, welcome to the show.
Thank you.
My pleasure. And so I would like to connect with you on mindfulness and in the world of psychology, how they are connected, and make this conversation impactful for our listeners.
Sounds great.
And the very first thing I would like to ask you, how does your family describe? What do you do for a living?
How do I describe what I do for a living?
And your family, how do they describe?
How does my family describe it? So some of them probably don't really know. Some of them, it's probably pretty new to them. You know, it was probably something new to them when I started my studies. My family wasn't a family that grew up talking about therapy or aspiring to be psychologists or psychiatrists. That just wasn't part of our worldview, I guess. I'm a Midwesterner all my life, and I grew up in a pretty small town, and it just wasn't something that people were really doing. And so now I think that most of them could explain that, you know, I do therapy with people and I help them figure out their challenges and how to meet their challenges with greater skillfulness and find greater happiness. But I think that in the beginning it was kind of a mystery to them what I did. And then in terms of the mindfulness, a lot of my family, that's pretty new to them as well. I have some family members that practice, but the older generations, that's not something that they were exposed to. I don't even remember there being yoga available probably until I was maybe in college. So yeah, it's pretty new stuff for them. But I think they appreciate it in observing its impact on me. So they might not understand exactly what it's all about, but they have over the years certainly commented on the changes they've noticed in me.
And how did you get into the world of psychology? What was your motivation?
So it was kind of a roundabout journey. Originally, I thought that I'd be an artist. And once I started to discover what that really meant, if you were going to actually make a living, I started to change. I changed my major, and I actually graduated college with a journalism degree. And I worked for a while for a newspaper. And through some of the stories that I had to help do for the newspaper, I started to see what psychologists did. So one story I was involved in was going to a juvenile detention center. And there were psychologists working there, and I thought it was pretty amazing. I got to sit with them and interview them, and I was impressed by their dedication and their desire to help these kids have less suffering in their lives and be more successful. And that just sparked my curiosity, and I started investigating. And I actually had to go back to undergrad to take some classes and get a major in psychology so that I could then move on to my master's and my doctorate. And actually each level of my education, I still wasn't certain that I wanted to go all the way to the end where I am now with a doctorate. But each stage in my journey, I just knew more and more and more that it was the right fit. And it gave me a sense of meaning and purpose in my life that was really important. So I'm very grateful that somehow I did stumble upon that that choice of career, and also really grateful for what I've learned from having the privilege of being invited into other people's private worlds and to see things and hear things and understand things I probably never would have been exposed to otherwise. And to be able to see people's inner strength, that they are capable of surviving and thriving in the face of enormous challenges, and that we all have that inner strength that we can tap into. I think being a psychologist or a mental health professional really gives you this unique view and this unique perspective that most people don't get, and it's really a privilege.
And how does it help you in your personal life being a psychologist when you work with different kinds of patients?
Yeah, so it definitely puts things in perspective.
That is very important.
Yeah. So, when I have struggles, I definitely know of people who've had much, much tougher challenges that they've had to face, and they've been able to meet those challenges with grace and dignity. And I can think about those people when I'm having my own challenges and feel hopeful and feel empowered that I too can meet my own challenges with courage. And I think that, in my personal life, sometimes it can be interesting when people find out I'm a psychologist. I'm sure lots of psychologists would relate to this, but, when people find that out, lots of people have ideas about what that means or what kind of person you are, or how you might be looking at them because you're a psychologist. And, there's a lot of interesting portrayals of psychologists and psychiatrists in the media, on TV, and in the movies.
And not to interrupt you here, so you mentioned about psychologist and psychiatrist.
Uh-huh.
So what's the basic difference between psychologists and psychiatrists for the listeners who may not be aware of? Because what happens is when we go through mental problems or mental health problems, and for the listeners, if we have any mental health problem, it doesn't mean that we are nuts, we are mad. We all have those issues, and we get to work at it through
That's right.
a psychologist or a psychiatrist. So Dr. Tracy, how would you distinct between these two words or these two terms?
Yeah, that's such a good question, because most people probably don't even know that, that there is a difference. But the easiest way, I think, to remember it is that a psychiatrist is a physician. So a psychiatrist has gone through medical school, and they have a specialization in mental health treatment. A psychologist has not gone through medical school. We've gone through another kind of training, and psychologists can have different kinds of degrees. So you notice that at the end of my name, I have a PsyD instead of a PhD. And a PsyD is a more clinical training, more focused on treating people. And this is really general because all the programs can differ, and some PhD programs are very clinical, and some PsyD programs are more research oriented. But PhD programs tend to be more research focused. And then there are even some psychologists from years ago when you needed a master's degree to be a psychologist. Some are still grandfathered in, so they may have like an MA or an MS after their names. And there are even some psychologists that have an EDD, Doctor of Education. There are school psychologists and organizational psychologists and clinical psychologists and educators that are psychologists. So it's really hard, I think, for the general public to understand what the differences are and what all those letters mean after your name. A psychiatrist will usually have an MD after their name.
So if somebody is going through any mental health problem, then how should they decide the path or the route? Where should they go? To a psychiatrist or a psychologist?
That's a great question. Yeah, I think anymore, unfortunately, psychiatrists almost exclusively prescribe medications. There are some psychiatrists that still do talk therapy, but I think it's pretty rare these days. So if you're wanting medications, mostly you're going to choose a psychiatrist. Some psychologists in some states, a few states, can prescribe, but it's very rare actually that you'll encounter a psychologist who can prescribe medication. So a lot of times you need both. A lot of times you need to talk to a psychologist for your talk therapy, for your behavioral change, and you need to talk to a psychiatrist to be prescribed medication.
Can you give us any instance, the real world instance when somebody needs to go to a psychologist and they need to go to the psychiatrist? What could be that issue?
Well, I'm a little biased, so I'll say that in advance. But I think that for the most part, if you're going to take medications for mental health, it's also a good idea for you to have some behavior therapy as well, because the medications can, of course, make some changes in your biology, but there are probably also some habits that you have that could use some change, some habitual ways of thinking or responding that may create some suffering in your life, and medication alone often can't change those kinds of habits.
Can you suggest or explain any, I'm thinking about that, any issue or any suffering, any disease name?
With that would just want counseling, or that would need both?
It can be both, yeah.
Oh yeah, so like major depressive disorder or generalized anxiety disorder, those are very common mental health conditions that would probably benefit from consulting with both kinds of professionals, depending on the severity. Sometimes people can treat their mental health concerns just through talk therapy. That can happen. And then there are some people that really can't live to their potential without their medicines. An example might be somebody with schizophrenia. For somebody with schizophrenia, taking their medicine is going to be really essential to them to be able to function to their potential.
So it is different for each individual.
Totally. Mm-hmm. Yep. And it's an experiment. A lot of times you need to experiment before you can kind of figure out what the right combination is for you. And having somebody to help you through that is really important.
Do you remember any personal challenge from your life and you were able to heal that challenge through some perspective from your client?
Oh, yeah, so many. I mean, one of my favorites is marriage therapy. So I'm married, and I'm very fortunate to have a good marriage to a wonderful partner. Um, but definitely when I do marriage therapy with people, which isn't a primary part of my practice, but I do a little bit of that, it's so helpful to me in my own marriage to see how people are meeting challenges in their relationships and what works for them and what doesn't. And, really helps me appreciate that, challenges are inevitable in relationships, that these things are going to come up and that we don't have to see them as deal breakers, that we can often work through them if we are patient and kind and compassionate, and also set good boundaries for ourselves, and that difficult times pass. There are good times and difficult times. They come and go, and that we can be patient through that process. So, yeah, there's so many examples like that.
And how do you set boundaries in a relationship, or it can be any sort of relationship?
Yeah. Well, it is also an experiment to find out, what works in a given relationship, and every relationship's different. But there are times when you just come to discover that that you need to draw a line. I think it's best if we can be fairly flexible, but sometimes we may get into a situation where somebody's taking advantage of us or being abusive to us, and then we really need to draw a line there in order to protect ourselves, and also to not kind of let that person engage in that kind of destructive behavior with you.
And I would like to go back to your graduate degree for a while. So you already had a graduate degree in journalism. You were already working in journalism. And then you decided to go to undergrad to study psychology. So it's a reverse route,
Yes.
So and the reason I'm asking is because a lot of people want to do different things. At some point we think this is working for us, and after a few years we realize that, okay, we want to go to a different path, and that change of path is very difficult. Because of our age, we think, okay, we are in 30s, 40s, it's not for us now. And you decided to change that route from a graduate degree to undergrad to study psychology. So how did it go? Was it challenging, and what was your motivation level at that time?
It wasn't terribly challenging in the sense of reluctance, because my life was very hard at the time, because a journalism job where I lived paid, I think it was something like $5 an inch of written text. So, and you can't, space is a premium in a newspaper, so I had to work other jobs just to feed myself. So I was highly motivated to reconsider what I was going to do for a living. So that part wasn't hard. And actually also going back to school as a little bit of an older, more experienced person was better too. I feel like I was a better student. I was more motivated. I was more self-directed. I understood what my own goals were a little better. But the hard part was the money, definitely. I mean, I was already, really living hand to mouth. And then going to graduate school and paying for graduate school was really hard. I mean, there were times when I really didn't have enough to eat. I didn't know if I was going to be able to pay the rent. So I think that was the biggest challenge. But, looking back on it now, I can say it was very much worth it. I don't know, how things would have played out if I hadn't made this change. I think the change needed to happen.
Do you have any advice for anybody who is having this dilemma to change their careers?
Yes, I would first say, I think you were hinting to this, Nishant, that it's very common that I remember years ago learning the average number of times people change careers, something like that. It's like 7 times or something like that. Changing your major, changing your career, kind of changing direction in your professional life. It's very common. And, so, sometimes it's a big change, like the change that I made, where you have to really kind of start again in some sense. But sometimes it's just a little shift, like you're shifting lanes. And then it might not be so much groundwork that you have to lay for that. But I would say, definitely keep an open mind and explore. And one thing I did is I talked to people. I cold called psychologists basically and asked them about, what did they like about their career? What didn't they like? Would they do it again if they had it to do over? And almost everybody I talked to said that becoming a psychologist was one of the hardest things they did in their lives, but it was also being a psychologist was one of the most rewarding things they'd ever done in their lives. So that helped me feel more confident. So reaching out and talking to people who are actually doing what you're thinking of doing, maybe seeing if you can shadow them before you start to make a move, can really help you feel more confident that you're making the right decision for yourself.
And I have this privilege right now to ask you, what do you like about being a psychologist?
Yeah, I think the thing that I like the most is this real sense of honor and privilege and humility that I have, that people invite me into their lives in such an intimate way and trust me to share with me their deepest fears, their biggest challenges, their frustrations, their joys. That part, really, it almost brings me to tears when I think about it. It's just so amazing. And I know that, this doesn't happen much in my everyday life and the other parts of my life. I just don't think very many people get this kind of honor. So that is what I'm most grateful for.
And in your personal life, people who know that you are in this field, do they feel more open-hearted towards you, that they can share anything with you because they know you can understand?
I'd have to ask them, but I would suspect no. I think that that the people in your personal life, especially if they've known you your whole life, they just know you as you. And like I was, I've talked to other psychologist friends, and we laugh how we could be at the dinner table with our family, and somebody could be talking about some mental health thing like depression or something, and they never think to ask you, like, there's a psychologist sitting right here at the table that you could ask. But they just see you as sister or brother or daughter or son, and but perhaps people who haven't known me all my life, maybe some of those skills that I've learned talking to people in therapy, maybe some of that comes through. I hope it does, and I hope people sense an openness and a genuineness and a non-judgmentalness in me.
And therapy, I think some words are confusing to a general population, like therapy, counseling, going to a psychologist. Are they the same words? with different connotation, or how they differ?
In some ways, yes, they are. It kind of reminds me of the difference between Kleenex and tissue. Right? Kleenex is copyrighted, or trademarked, I should say, trademarked. And so that's the same with like therapy and counseling and psychotherapy, that, you know, certain groups or governing organizations claim those words, and they come to represent certain things. So counseling was often, you know, claimed by people in, you know, in counseling centers and colleges and educational institutions. Therapy was often a more generic term that anybody could use. Psychotherapy was claimed by psychiatrists, and especially psychiatrists of a certain orientation. But it's like any language, really. You know, we give meaning to words, and that changes over time, and different eras use different words for different things. So I wouldn't get too caught up with it. To me, I feel like if somebody says any of those words, I feel like they mean just about the same thing.
And then how does coaching fit into all of this? Because coaching is quite popular, very popular these days.
Yes. I actually did a little coaching for a little while. I was curious about it, and I found that it was very hard to maintain that line between coaching and counseling. And I would suspect that many people who are doing coaching have to be really careful about that.
You mean receiving coaching or giving coaching?
Giving coaching. You really have to be careful, because when you're working one-on-one with somebody on their goals and aspirations and their challenges, it would be really easy for it to drift into therapy. And so really understanding where that line is, I think, is important. I think somebody who's been certified as a coach by a major organization probably has some good education and training around that boundary, but coaching is still kind of the Wild West. Mindfulness is too. I mean, this is an interesting thing about mindfulness is, you know, you don't have to be certified in this country right now to teach mindfulness. So there's all kinds of different things you might get if you seek out a mindfulness teacher. So I think coaching is kind of that way too, and you just have to, you know, do your research and probably interview the person and make sure you're really going to be getting what you're looking for.
And speaking of mindfulness, you have so much experience with mindfulness. You have certifications. You are a trained mindfulness practitioners. And I would like to ask you, how does mindfulness fit with psychology?
So I became interested in mindfulness because of my work as a psychologist. I hadn't been exposed to it in any other way. Like I said, there was no yoga or meditation going on where I grew up, and people in my life didn't do that kind of thing. And as a result of my psychology training, I learned a couple of different treatment techniques that used mindfulness concepts and practices as part of the approach to treating depression, anxiety, personality disorders. And that piece of it really stood out to me. It was just so very different from the other approaches I'd learned. And I decided I wanted to know more about it. And it was actually not so easy here in the Midwest for me to learn more about it. I started, like most people do, doing a lot of reading. There was really nobody nearby who was doing secular mindfulness, but there are several Buddhist centers in town who were, teaching mindfulness as part of the Buddhist training. So I started going to a Buddhist group and learning everything I could through that group. And eventually I discovered that there was a mindfulness-based cognitive therapy training happening through the University of San Diego, UCSD. And I felt like that would be a great complement to my work because it focuses on treating people with major depressive disorder. So
and
that
what happens in cognitive therapy?
So mindfulness-based cognitive therapy is a combination of cognitive behavior therapy. I would say it's not even really therapy. It's more of teaching some of the concepts and also mindfulness training. So it melds those two together. So MBCT, I feel like in a way it's kind of unfortunately named because it doesn't feel like a therapy session when you're in MBCT. It feels very much like if you've ever been in an MBSR group.
What is MBSR?
Mindfulness-based stress reduction. That's John Kabat-Zinn's groundbreaking program that really brought mindfulness to medicine. In the I believe it was maybe in the 80s, early 80s, he developed a program at UMass that treated people with chronic pain for whom the medical professionals had no more to offer. These were people that were suffering terribly and there was nothing more that the medical world could do for them. And he developed a program that taught mindfulness basically to these folks and had incredible results. And it grew, the program grew and grew and grew and grew. And then it branched out into lots of different offshoots. Mindfulness-based cognitive therapy is one of those. So this is the typical 8-week program that people go through. I think it was maybe Anderson Cooper did a program on it. You can find it on YouTube with John Kabat-Zinn and Anderson Cooper. It's a pretty good documentary of the MBSR program.
And coming back to the basics, because not everybody knows about mindfulness. What is mindfulness?
Well, I'm glad you asked that because it definitely has broadened this definition as it's become more popular. But the way I describe it is it's really a way of being. It's a way of living your life. And that we all have this innate capacity to be mindful, but many of us have kind of drifted away from it in our training. The way the world sort of trains us away from being non-judgmentally present in the moment. And we can learn through a number of different practices how to re-strengthen this ability. And so it's a way of being. It's also a practice or a set of practices. It's also, some people have this as kind of a trait. Some people are just kind of naturally more mindful, just kind of part of their personality. And it can also be a state. There can be periods of time when we're very mindful and other times when we're not. It can be a state of being.
And do you incline more naturally towards mindfulness or towards the stressful side?
So interestingly, I don't think I incline toward the stressful side, but I think that I have fairly poor attention, and mindfulness has helped me a lot with that.
How does it help you?
Well, mindfulness practices really train your attention. So if you've done the classic mindfulness of breathing, the instructions are to see if you can keep your attention on your breath, and each time it wanders away to bring it back. So just like lifting a weight would build your muscle if you repeatedly lifted that weight over and over again, repeatedly focusing and shifting your attention builds your attention muscles. it strengthens those pathways in your brain.
So breathing is one of the mindfulness practices.
Mm-hmm. And there are many.
Can you explain those, please?
Sure. There's, people have gotten really creative, so you could probably find mindful anything now. But some of the basic ones are mindfulness meditation. And during mindfulness meditation, we're attending to some object of focus. And each time our mind wanders away, we're bringing it back again and again and again. Oftentimes that's the breath. Sometimes it's body sensations. It might be other kinds of sensory experiences like sounds. There's mindful eating. There's mindful walking. There's mindfulness of everyday experiences. So you could
mindful parenting as well.
What did you say?
Mindful parenting.
Mindful parenting, yes. There's mindful. I've heard that there's mindful wine drinking. I've never done that.
Mindful wine drinking.
Yes, I've seen that advertised.
I think mindfulness is becoming a buzzword like it used to be authenticity. Everybody's using authentic word in corporate leadership everywhere. I think mindful leadership, mindful corporate, it's becoming a buzzword everywhere.
Yes,
mindful compassion.
Yes, and I also heard somebody say that they saw a mayonnaise brand called Mindful Mayonnaise. So yeah, we have to be a little careful because we can make it meaningless, right? If we
overusing this word.
Yeah, and in fact, people can kind of get resentful of it, or could there be
burnout on the same word.
Yes, a backlash. There can be a backlash. Yeah.
And what challenge do you see in this mindfulness thing? Or let me rephrase my question. What challenges people face in practicing mindfulness?
Well, here in the Midwest, one of the first things is that they just don't know what it is, or they have a very surface kind of notion of what it is and don't understand why it would be useful. And you can see that if you don't really understand what it is or why it could be beneficial, why would you even want to practice it? Because, for a lot of people, that sounds just excruciatingly boring to sit still and silent, or painful, right? To sit still and silent for any period of time. So one of the biggest challenges has been trying to help people understand what it is and why it would be beneficial. And then the next challenge always is people saying that they don't have the time. So, I think everybody, that's a pretty universal problem here. And lots of teachers have worked hard to create practices and expectations that are reasonable, that are portable, that can be used with minimal tools or need for space, to make it as convenient as possible for people, especially in the beginning. Once they start to experience the benefits for themselves, often they find they can make space for it in their lives, just like we make space for other things that we really value or enjoy. But in the beginning, oftentimes we have to help people have very reasonable expectations and, let them know that it's not really how long they practice, but the consistency of their practice.
This is a very powerful thing you just mentioned, that consistency matters. And it's a process, everyday process. It helps in that moment. But our stress and anxiety or depression, it will not go away forever. It is going to help you in this moment, in this present moment. And I think I think about it a lot of times these days, that mindfulness is something people start and they don't perceive and they're not consistent for a long period of time. And that requires a behavior change. And that is tied to psychology. You are changing somebody's behavior, and behavior change takes time, and minimum 21 days, depending on the complexity of the behavior.
Nishant, I think you're saying something really important, which is, it is true that mindfulness practice can help us right in the moment, but also the consistency of our practice is what makes lasting change. The things that we discover about ourselves and our habits and patterns, that takes time to develop.
Can I share my experience over here?
Say that again?
Can I share my experience?
Oh, yes, I'd love to hear your experience.
So whenever I struggle with eating chocolates, I go extreme. I don't operate in moderation in my life, if I do it or just don't do it.
Mm-hmm.
So I set this 3-day rule for myself. If I can stop myself and develop some sort of self-control for first 3 days, then it becomes a lot easier for me. And I think our listeners can definitely try this 3-day rule for anything.
Yes.
And then it's a muscle, muscle starts building, and first 3 days it's tough, it's like, you're lifting a weight, and then you're feeling sore pain in your muscles. And
yes.
Then from 3 days to 6 days, then 6 to 12, 12 to 24, and then it becomes a habit. Then it becomes automatic habit. And I started meditating about 3 years ago. It was tough. I didn't know what I was doing for first 6-7 months, but I was consistent for 1 minute, 2 minutes every day. And at this point, I can easily meditate for 20 minutes to 30 minutes. And it is becoming an ingrained habit for me every single day.
Can I ask you a question?
Please.
What kept you going those early months?
The desire to learn new things, because I see people who are successful, who are fulfilled. I would try to mimic what they're doing in their lives, what different they have in their lives, why they are so happy. And I used to follow Dr. Wayne Dyer. If you have heard of Dr. Wayne Dyer.
Yes.
In the world of spirituality. And I started doing that, and a lot of medical doctors, including Deepak Chopra, everybody was talking about the benefits of meditation because our brain changes. And then I started reading scientific studies on meditation. Meditation is just one of the practices in the mindfulness. So everybody was talking about meditation, scientific study. There have been case studies where they, before and after brain image, before meditation and after meditation, the brain changes. We create different neuropaths in our brain, our ability to think differently, our ability to expand our thinking. Long answer. So this is the...
Nishant, I think you're saying maybe there were two big things that helped you get through those months when you didn't know what you were doing. One was that you knew a lot of people that you trusted were behind this practice. And then the other part was the science was backing it. So it gave you faith to keep working at it.
Exactly.
Yeah. Yep. And I think that's so important to recognize that different people are motivated by different things, but there has to be something that helps them get through those early days and weeks and months when you feel like I'm not doing this right, or I don't know what I'm doing. And that's part of why we developed the Midwest Alliance for Mindfulness, because it created this group of teachers, experienced and trained teachers, but also this community of people that were all going through this process together. And so now we have these really great folks called Mambassadors.
Mambassadors, what is that?
So they're people in our community that have been practicing with us for a long time, and they have a consistent practice. But they're just regular people. They're not teachers. And the newer people in the community can reach out to them to ask questions or to talk about challenges. And this is a little less intimidating for people, but also this, connection with real people in the community that are going through what you're going through helps people persist when they're feeling doubtful or they're feeling uncertain. And then also, we think it's important to share information about the science because some people are science-minded like you, and it really helps them, wait out, be patient with that period when they're looking for what the results are going to be for them. And also we, of course, introduce people to some of the famous people in the field. Maybe you might call them the gurus, the John Kabat-Zinns and the Deepak Chopras and all those people that help us, right, feel like, okay, these people, we trust them and they're saying this is good stuff. So it helps us get through the difficult periods.
And with all these mindfulness practices, I strongly feel that, and I would love to take your opinion on that as well, that it helps us to be a better human being, to connect with ourselves and to connect with others in a more kind, compassion, and resilient way. We can understand somebody's perspective. We can understand where they are coming from and seeing the situation or any circumstance through somebody else's lens, not from our lens. And this is very difficult thing to practice every time.
I love that you bring that up, Nishant, because oftentimes we do get into it for individual reasons at first. We have our own personal suffering or our own personal dissatisfactions. But as we practice, we discover that it actually has much, much wider benefits, that we start to see how we're all interconnected and how our actions impact other people and how this all comes back around to us. And we do develop these through the practice, it almost feels automatic that we begin to develop these qualities, these beneficial qualities, like patience and compassion and trust, all these kinds of things that really help us be in better relationship to others. And then this is sort of this beneficial cycle that ripples out into the larger community.
Is there anything in your personal life when you really apply, or I should say you face challenges in the application of mindfulness?
When I struggle to apply it, I think definitely the most advanced practice of mindfulness is in relationship. Yeah, it's much easier to practice on your cushion by yourself or when you're washing the dishes. But to remain mindful in a conversation, just like we're having today, although it's a little easier because we don't have lots of distractions, but to remain mindful when you're in conversation with somebody, interacting with somebody, that's tough. And then especially if there are strong emotions that arise, right, to maintain your equanimity, to maintain your calm, non-judgmental observation is very challenging. People can trigger us in ways that can make us lose our mindfulness.
Exactly. And it happens all the time. And I can give a small example on this. That this morning, somebody reached out to me for a certain thing and they wanted it immediately. Mm-hmm. And I was like, why they do it all the time? Why they do this thing all the time? Why don't they plan it accordingly? And that was my narrative. And then I took a step back and I started to giving different meaning to that. Because I asked myself, how can I change this narrative in my head? I don't like this narrative. What can I do to change the meaning? Then I started saying myself, I'm grateful for having this opportunity. At least we are having this global pandemic. At least I'm having this opportunity. Somebody's asking me something and it's an opportunity for me. So I'm grateful for that. So being mindful in my own head to change that narrative.
It creates a space for you, right? Where you can observe what your thoughts are doing and make a choice about how you'd like those thoughts to go. When we're not mindful, we don't have that space, and so then we don't have that choice.
And the great thing about mindfulness is not judging yourself for any freaking thing. You don't have to judge yourself for anything because it's a thought. Don't put any judgment label on your thought.
That's right. We can still be discerning, right? We can still decide whether an action we took was useful or not, or helpful or not. But we definitely don't have to beat ourselves up about it and get discouraged about it. We can resolve to make different choices. And especially if we're making space to be able to observe our thoughts and our urges before they happen so that we can make good choices about them.
Exactly. And before I ask you my last question for this conversation, Dr. Tracy, I would like to ask you that what books in your life have impacted you the most positively, for sure?
Oh, let's see. I really was changed by the book Man's Search for Meaning by Viktor Frankl. Are you familiar with this book?
Yeah. I've read that book many times. Man's Search for Meaning by Viktor Frankl.
Yes, that's very, lots of people are familiar with that book. And there's a book that I read in college that just kind of blew my mind, but I'm not going to be able to pronounce the person's last name. But the book was very simply called Change. And the author's last name is W with lots of consonants, C's and Z's and stuff. I would recommend that book. It talks about how we make change in our lives, and it's very related to mindfulness. And then there's these kind of first order surface level changes that we can make. And then there are also these deeper second order kinds of change that often happen paradoxically, based on our ability to just accept what's happening in the moment. And the deepest changes almost often come out of that kind of stillness and acceptance. So that would be another good book. And then, of course, if you're a mindfulness buff, you have to read Jon Kabat-Zinn's Full Catastrophe Living.
Full Catastrophe Living. Okay, I will put all these book names in the show notes.
Yes.
All right, Dr. Tracy. So where can people find you online?
You can find me at mindfulness-alliance.org.
Great.
All our classes are online now, so if anybody wants to check us out, you don't even have to come to Kansas City to do it.
Awesome. Great. Thank you so much, Dr. Tracy. It's been a great conversation, fun, flowing conversation, and mindful conversation with you.
Wonderful to talk to you, Nishant.
Thank you. Thank you for listening to this podcast episode today. I hope you learned from this episode that you can apply in your life. If you did enjoy this, please subscribe to the podcast, The Nishant Garg Show, on Apple Podcast. You can also subscribe to the show through my website, https://nishantgarg.me, nishantgarg.me. You can also share this podcast with your family and friends or whoever want to feel fulfilled. And thank you so much again.